There are numerous supplements available that promise to reduce high blood pressure. While some are effective, others may not be as reliable. In this video, I'll give you the top 10 supplements that have been proven in scientific studies to lower high blood pressure. 1. Magnesium. Magnesium is a crucial mineral involved in numerous physiological processes, including the regulation of blood vessel function. It helps relax blood vessels, which can reduce vascular resistance and lower blood pressure. Additionally, magnesium plays a role in the balance of electrolytes such as sodium and potassium, which are vital for maintaining normal blood pressure levels. A meta-analysis study published in the journal Hypertension in 2016 analyzed data from 34 clinical trials involving more than 2,000 participants. Results showed an average dose of 368 milligram of magnesium per day for 3 months resulted in an average reduction of 2 mm mercury in systolic blood pressure and 1.78 mm mercury in diastolic blood pressure. The study concluded that magnesium supplements could be considered as part of a dietary approach to manage high blood pressure. Do you find this video interesting so far? Please do subscribe to our channel to get more health-related videos. 2. Potassium. Potassium supplements help lower blood pressure through several key mechanisms. Potassium is an essential mineral and electrolyte that plays a critical role in maintaining fluid balance, nerve function, and muscle contractions. One of its primary functions in blood pressure regulation is to counteract the effects of sodium. High sodium levels can increase blood pressure by causing the body to retain water, thereby increasing the volume of blood and the pressure on blood vessel walls. Potassium helps the body excrete excess sodium through urine, reducing blood volume and pressure. Moreover, potassium aids in the relaxation of blood vessel walls, which further helps lower blood pressure. It improves the function of the endothelial cells lining the blood vessels, making them more flexible and less likely to develop high pressure. A meta-analysis study found that an increase in potassium intake of 1,640 milligram per day was associated with a reduction in systolic blood pressure by 4.9 mm mercury and diastolic blood pressure by 3.0 mm mercury in individuals with high blood pressure. Check out our videos on the high potassium foods you can eat to lower your blood pressure. 4. Vitamin D. Research shows that people with high blood pressure tend to have lower levels of vitamin D than those without this condition. One significant way vitamin D can affect blood pressure is by modulating the renin-angiotensin system, RAS, which plays a crucial role in blood pressure regulation. Vitamin D suppresses the expression of renin, an enzyme involved in the production of angiotensin II, a potent vasoconstrictor that raises blood pressure. By inhibiting renin, vitamin D can reduce the levels of angiotensin II, thereby lowering blood pressure. Additionally, vitamin D has anti-inflammatory and antioxidant properties that can improve endothelial function. The endothelium is the inner lining of blood vessels, and its proper functioning is essential for vascular health. Vitamin D helps maintain endothelial cell health and reduces oxidative stress, which can lead to improved vasodilation and reduced blood pressure. 5. Nattokinase. Nattokinase is an enzyme extracted from natto, a traditional Japanese food made from fermented soybeans. It's been studied for its potential cardiovascular benefits, including lowering blood pressure. Nattokinase has been shown to inhibit angiotensin-converting enzyme, ACE, which plays a role in regulating blood pressure. By inhibiting ACE, nattokinase can promote vasodilation, widening of blood vessels, thereby lowering blood pressure. Additionally, nattokinase helps break down fibrin, a protein involved in blood clot formation. As we get older, the levels of plasmin, the enzyme that breaks down fibrin, the blood clotting agent, start to decrease. This leads to thicker blood and consequently higher blood pressure and an increased risk of stroke with each passing year. However, by taking nattokinase, your blood circulation can improve, which naturally lowers your blood pressure. One study found nattokinase could lower your systolic number by up to 10 points and diastolic number by up to 5 points. 6. Garlic. Garlic supplementation has been shown to help lower blood pressure through several mechanisms. The primary active compound in garlic, allicin, is produced when garlic is crushed or chopped, and it offers various cardiovascular benefits, including the ability to reduce blood pressure. One key way garlic works is by promoting the production of nitric oxide, which helps relax and dilate blood vessels, thereby improving blood flow and lowering blood pressure. Additionally, garlic has anti-inflammatory and antioxidant properties that can reduce oxidative stress and inflammation in the cardiovascular system, further aiding in blood pressure regulation. Garlic also inhibits angiotensin-converting enzyme, ACE, similar to some blood pressure medications, leading to decreased blood pressure. On average, garlic can lower systolic blood pressure by about 7 to 10 millimeter of mercury and diastolic blood pressure by about 4 to 6 millimeter of mercury, though these effects can vary depending on dosage, duration of supplementation, and individual response. Garlic is generally safe for most people when taken in recommended amounts. However, it can cause side effects such as gastrointestinal discomfort, bad breath, and body odor. Therefore, it's important to consult with a healthcare provider before starting garlic supplementation to ensure it is safe and appropriate for individual health needs. 7. GABA, gamma-aminobutyric acid. Gamma-aminobutyric acid, GABA, is a neurotransmitter known for its calming effects on the nervous system, and its supplementation has been studied for potential blood pressure-lowering benefits, especially in those with stress-induced hypertension. GABA helps reduce neural excitability and promote relaxation, thereby lowering stress levels and stress-induced increases in blood pressure. Additionally, GABA can influence the autonomic nervous system, which regulates heart rate and blood vessel tone, promoting blood vessel dilation and improved blood flow, which can reduce blood pressure. Clinical studies have shown that GABA supplementation can significantly reduce blood pressure, with some studies suggesting reductions of about 4 to 6 millimeter of mercury in systolic blood pressure and 2 to 4 millimeter of mercury in diastolic blood pressure. 8. Melatonin. Sleep plays a crucial role in maintaining healthy blood pressure levels, as quality and duration of sleep significantly impact cardiovascular health. During sleep, the body experiences a natural drop in blood pressure known as nocturnal dipping, which is essential for cardiovascular rest. Poor sleep can disrupt this dipping, leading to elevated blood pressure and increased risk of hypertension and cardiovascular issues. Additionally, adequate sleep helps regulate stress hormones like cortisol, and poor sleep can result in elevated cortisol levels, which can raise blood pressure. Quality sleep also reduces sympathetic nervous system activity, which helps prevent the constriction of blood vessels that can increase blood pressure. Melatonin, a hormone that regulates sleep-wake cycles, can aid in improving sleep quality and potentially lower blood pressure. By helping individuals fall asleep faster and maintain better sleep patterns, melatonin supports the natural nighttime dipping of blood pressure and contributes to overall cardiovascular health. Furthermore, melatonin has antioxidant properties that protect blood vessels from oxidative stress, which can help reduce the risk of hypertension. Some studies have shown that melatonin supplementation can have a modest effect on lowering blood pressure. For instance, research has indicated that melatonin can lower systolic blood pressure by about 3 to 5 millimeter of mercury and diastolic blood pressure by about 2 to 3 millimeter of mercury. 9. Grapeseed extract. Grapeseed extract is a supplement derived from the seeds of grapes known for its rich content of antioxidants. Grapeseed extract works by promoting vasodilation, improving blood flow, and protecting blood vessels from oxidative stress. The antioxidants in grapeseed extract help reduce inflammation and improve the health of the endothelium, the inner lining of blood vessels, which can lead to more relaxed blood vessels and lower blood pressure. Clinical studies have shown that grapeseed extract can significantly reduce both systolic and diastolic blood pressure, with some studies reporting reductions of up to 10 millimeter of mercury in systolic pressure and 6 to 8 millimeter of mercury in diastolic pressure. 10. Fish oil. Fish oil, rich in omega-3 fatty acids, is well known for its cardiovascular benefits, including the potential to lower blood pressure. The omega-3 fatty acids in fish oil help reduce inflammation, improve endothelial function, and promote vasodilation, which collectively contribute to lower blood pressure. They also help reduce triglyceride levels and may decrease the production of substances that constrict blood vessels. Clinical studies have shown that fish oil supplementation can lead to modest reductions in blood pressure. For example, research suggests that fish oil can reduce systolic blood pressure by about 4 to 5 millimeter of mercury and diastolic blood pressure by about 2 to 3 millimeter of mercury, with more pronounced effects observed in individuals with hypertension or high cholesterol. Check out our next video on how to lower blood pressure naturally at home.